And welcome to our webinar, Closing Care Gaps with House Calls Pro. We're going to be talking through our recall solution and how we can help your patients schedule appointments for their recalls. So let's go ahead and dive in. One of the first things I want to highlight, I don't know if many of you know, but Intrado has been serving healthcare for 30 years now. This has kind of been a broad range of different companies over the years. Some of you know us as TeleVox, some of you know us as Clientele, Phone Tree, Call Point, but we're all under the name Intrado. And like I said, we're celebrating our 30-year anniversary this year, so we're really happy to be servicing all of our healthcare customers, and we continue to do so for 30 years plus. I wanted to introduce myself. My name is Tabitha Jung. I'm one of the senior product managers here for healthcare at Intrado. I enjoy this position, and like I've done a couple of webinars in the past, so you guys maybe have seen me before, but I'll be your host today, and we'll be continuing on with the information, okay? Okay, so for today, I really wanted to highlight a couple of things in relation to closing care gaps. And one of the biggest things that I wanted to go over was a recent Chime survey that Intrado performed late last year and some of the results from that. And then we wanted to talk about the House Calls Pro product and the automated workflows related to recalls and closing care gaps. And then how we can help your patients schedule those recall visits and the best ways that we can do that and enable that based off of your EHR. And then lastly, we're going to leave a little bit of time for Q&A so that you guys can ask your questions. If there's anything that we need to follow up on after the fact, we'll be sure to send out the recording, those follow-up questions and answers, and other materials presented if you're interested. Okay, so as stated, Intrado recently surveyed members of the College of Healthcare Information Management Executives, or CHIME, a lot easier to say, and it did include chief information officers and other health IT professionals. So we wanted to really get an idea of what their goals were for, the organization. What are some of the pain points that they're seeing? What are some of the different ways that they envision technology to help in their solutions and their engagements with patients? So I just wanted to cover some of the recent stats that we received from that, because it's really valuable information, and I think a lot of you will probably resonate with a lot of what is shared. So from the survey, we saw that some of the top goals for health IT executives are as follows. 91% want to improve the patient experience. That's obviously one that I'm not surprised by at all. And then you have 68% wanting to increase care gap visits and 49% wanting to reduce call center workload. So these are some of the primary goals that we saw as indicated in the survey, like I said. And luckily, the closing care gaps and recalls workflow of House Calls Pro can help with all three of these items and really help close the loop on the goals that your organization may have. I also wanted to point out that if you are interested in some of the other data that was collected from this survey, we're happy to send that out to you. There's some really interesting information in there, and you can reach out to us for that, and we can pass along the information from the Chime survey. So some of you likely are aware of our House Calls Pro product. I wanted to call out some of the different, major themes that we offer in terms of appointment management, enhancing care, and then post-visit. So we really want to highlight the patient journey and how we can make the experience better for the patient. Within each of these, you can see some of the different components, so self-scheduling, appointment reminders, reschedule options, enhancing care, there's referrals management, scheduling preventive care, pre-procedure instructions so that we can, notify patients of instructions leading up to their procedure and make certain that they are, prepared. And then post-visit. So how are they doing after the visit? Do they have test results that we could share with them, or, they have a payment that needs to be collected? So these are kind of some of the major themes that we have for the House Calls Pro product related to the patient journey. And as you guys are all aware, this particular session is focused on closing care gaps. And so we're really going to be highlighting this enhancing care theme and scheduling preventive care and how we can do that. Okay, so another key detail that we got from our TRIME survey is 28% of patients report not knowing which health services are recommended for them. This is kind of astounding, honestly, and we want to make sure that your health system is educating them on the different preventive services that you offer, so that we can have a healthier population and a healthier community. So some of these different ways that you can engage these patients, related to recalls and closing care gaps, I kind of wanted to outline some examples, but really educating the patients on, when is it time for them to come in? This could be dependent on your health system or what your preferences are. But, letting them know that they're due for an annual wellness exam, or letting them know that they're due for a colorectal cancer screening, based off of their age and things like that. Flu shots are another one we've talked about in the past for webinars. We want to make sure that we're protecting not only the patient, but also their loved ones from the flu. Another example you can see down here is eye exams. A lot of times patients don't know when they're due for an appointment. Everyone gets busy, life gets in the way. There's a lot of different things going on in their lives as well. And we want to make sure that you're reaching out to them and providing them this information, and then really making it easy for them to schedule and come in for that particular visit. So I really wanted to highlight some of the different House Calls Pro scheduling options that are available. And again, these are available based off of your EHR. So we can try to make, the most sense for your health system. But there's a couple of different options. And in this chart, you can see that I've kind of outlined patient experience, because we know that this is a huge thing that your health system is set on, is improving the patient experience. But we also know that, you want to make sure that your staff isn't burdened, and that it's a lot easy, it's very easy for them to, schedule these patients, but not get in the way of everything else that they have going on in the day-to-day. So we'll be talking about each of these three scheduling options in a little bit more detail in a couple minutes. But I really just wanted to highlight, where they stand in terms of patient experience and staff burden. So the first one, schedule request. This one's a relatively low patient experience, mainly because they're having to, still indicate that they want to schedule, and then they're having to, wait for the office to contact them back. For the staff, it's very high burden. You're having to find the time to schedule this patient, reach out to them. Maybe they can't answer the phone right away. You're having to call back again. So that one's, available and obviously used. And if that's your only option, that's still better than nothing. But we want to talk about some of the ways that we can continue to schedule smarter. The next one is Live Connect. So in this example, it's a little bit medium. The patient's indicating when they want to talk to somebody on your staff, and your staff isn't having to manually outreach to them. We're connecting them. So we'll talk about that example and the benefits of it. And then lastly, self-scheduling. So enabling your patients to schedule themselves, whether that be patient portal URL or it's SMS self-scheduling if we have that option for your EHR. That's a very high patient experience. They can do it on their own. There's no staff interaction. It's, kind of a great win for everyone in the business, for the health system, and then for the patient as well. So diving into a little bit more detail here, we have our good scheduling options. This would be, like I said, a schedule request. So in this example, you can see we're reaching out to Kate, letting her know that her annual mammogram is due, and she's indicated that she does want to schedule that appointment. And then from here, we're capturing that she wants to schedule the appointment. We're letting her know that someone from the office will be contacting her within the next 24 to 48 hours. And then we're able to, update this within your EHR so that your staff is then able to make note that they need to reach out to Kate and let her know that she's due for an appointment, and then, do all of that scheduling from then on between the patient and the staff. And again, it's probably very obvious that all of these messages are configurable based off of what your standard turnaround time is, or how you want to interact with the patient. All of that could be updated in the message. The next option that we see here is a better option, like I said. So this would be SMS to Live Connect, or we have phone call to Live Connect. So in this example, you may have seen in a prior webinar some material provided by some of our sales teams. This is a really neat feature. So our patients are sent a text message or a phone call that says, you're due for a mammogram. And when you have time to speak with our scheduling associate, please reply 1. So you can see that in this example, Kate said, yes, reply 1, I have time to speak with a scheduling associate. And then when they reply 1, our system is immediately sending a phone call to the patient, and then sending, opening a connection with your office call center. And then we're going to connect the two together. So when the patient answers the phone, they'll hear, please stay on the line. We're connecting you with a scheduling associate. And they then get connected automatically to your call center so that they can then schedule that appointment. So, in this case, it's a lot easier for the patient. They've indicated that they have the time to speak, and your staff isn't having to, constantly reach back out to Kate. Maybe she didn't answer because she's in the middle of, car line pickup or something like that, or different things going on in her life and she can't answer. But she's indicated that she can. We're getting her on the phone, getting her connected, and then making that scheduled appointment and moving forward. And then lastly is the best scheduling option. So like I said, we talked about self-scheduling. So we really want to enable the patient to be able to do it themselves. I know if any of my providers offered this, I would be floored just to be able to go in and schedule an appointment myself without ever having to, wait on hold or wait to get in touch with the right person in the office to talk about scheduling. So here's 2 different examples where you could send out the link to your portal. If any of you request some more of the Chime survey information, we did learn that a lot of the communication delivered is via a portal for the patient. So this is, obviously something that you guys are highlighting for your patients, and we can, make sure to implement it within the messaging as well. So they could sign up and schedule their appointment via patient portal. And then as well as the House Calls Pro SMS scheduling. So this is kind of a key differentiator for our House Calls Pro product. And you can see in this example, the patient is able to self-schedule via SMS without any staff interaction. In this case, if we have this API integration with your EHR, we would be able to, when they indicate what date works best for them, we're real time going into the EHR, looking at what availability you have open, so that we can then provide those options to the patient, and then let them select from those available time slots, and then booking that appointment for them within your EHR, so that everything is kind of, we're closing the loop fully at that point, and there's no interaction between your office staff. And then we can continue to provide them with appointment reminders leading up to that appointment that they scheduled, so that, all of that communication is automated and streamlined, and all you're worrying about is having the patient show up and perform, the routine visit and wellness visit that they scheduled. So those are kind of the 3 scheduling options that we really wanted to highlight and talk about the different ways that you can educate your patients, let them know that, they need to come in for their service, and then obviously, not only educating them, but providing them with the options and the opportunities to schedule, whether that be completely on their own or whether it be still interacting with your office. I do want to highlight that, some situations you may want certain departments to be able to self-schedule, and maybe others you don't. So we do have the flexibility to be able to have some specific messages and, visit types be configured to do scheduling in one way, and then others be configured to schedule in another way. That's completely possible. So with that, I want to go ahead and open it up to questions. We do have the Q&A section here on the Zoom that you can feel free to add any questions and we can get them answered for you.
Okay, Tabitha, we do have some questions here, so I'll read these out to you, and if you don't mind responding to them. So you were talking about Live Connect on one of the slides. How do you ensure that our call center staff isn't overwhelmed with calls?
Yeah, that's a great question. So we do offer throttling functionality for Live Connect so that we can configure how many messages you want to be delivered within a 15-minute time interval. And that would be whether they're delivered via SMS or IVR. Those all count kind of towards the total there. But you would be able to specify how many you want delivered, specify exactly what time range. So like, let's set up what does your call center hours look like. If that's 8 to 5, we can say, okay, I want you to start making these Live Connect notifications at 8 a.m. I only want you to deliver 3 every 15 minutes, for example, and I want you to stop at 5 p.m. All of that's configurable. And then we also have the ability to set a lunch break. So if your staff goes out between 12 and 1 and you're not going to have anybody within the call center to take calls during that time, we can configure that. So we'll make sure to stop making calls, from 12 and then start picking them back up at 1 o'clock and continue on with the cadenced approach that we had.
Fantastic. So question, is this functionality available to all clients, or is it a separate module contracted service, specifically the self-scheduling workflow?
Yeah, so I think, we're talking to a couple of different EHR users in this webinar. So it would really be dependent on which EHR you're using and if we have that API integration available. And we can make sure to have your account manager or account executive talk with you about that and the availability. So please follow up after this discussion so that we can make sure to get your questions answered in relation to the self-scheduling piece. I would think that the patient, I would think that the patient portal, as long as your organization has that implemented, that would be available to all health systems. But the specific SMS self-scheduling would be dependent on the EHR that you have and if we have that API integration set up and available.
Okay, fantastic. So once everything is set up, how do you go about reviewing the messages and making changes?
Yeah, so we do have an operations portal for HouseCalls Pro where we're enabling you to log in if you would like and access what the different messages are configured for your account. You can go in and actually modify them real time. So the next time that we were to send messages out, those messages would be used and delivered to the patient. So we have a lot of flexibility there for you to not only see what the messages are, but also edit them in real time. And then I want to call out, because I know that could kind of make some customers, nervous, but we obviously have different user roles and permissions that can be granted so that, only people with the access that you want to have access to that can have the ability to do so. So we can configure separate users within the account to have some of them have, that kind of admin access and others, only have reporting or different other access points like that.
Okay. Question on throttling. So does this have more throttle control than a campaigns account? We can't throttle text messages currently, just phone calls that I'm aware of.
Yeah, so that's currently I believe they might be a current existing customer, perhaps on HouseCalls or one of the other legacy platforms. HouseCalls Pro does offer throttling for both IVR and SMS. So that's a really great pickup. Like I said, you would be setting that throttle rate to X number of notifications per 15 minutes. And depending on, if your list of patients has SMS as a preferred method or voice as a preferred method, we would be sending, those specific messages based off of the patient preference or based off of what your health system wants to send. And so those communications, you would have 15 total. That could be 15 SMS if that's how it lines up, or 15 IVR, or it could be a mixture of the two. But yes, it would be throttling for SMS and IVR.
Okay. So what data elements are needed for this type of message?
Yeah, so this one's really reliant on, what kind of information you want to provide. But at minimum, it's always nice to personalize a message, so you could use the patient name, and then obviously what the visit type is that you're trying to get them to come in for. But I would think really just those two key elements, we can make sure that we're reaching out to the patient, provide their phone number, and indicate, in your implementation of this feature, whether you want, always to send SMS or IVR, or different options that we have, like if one of them fails, send the other, different things like that. We can easily get this set up, and as long as you're getting the data over to us, we can make those notifications and start helping you close the loop on recalls.
Okay. Do you have samples of messages for educating patients?
Yeah, we do, like I said in the beginning, we have 30 years of experience. So we've had a huge opportunity to see how our customers are utilizing messages and scripts, and kind of put together best practices. So we would love to work with your organization to, make sure that you're using best practice scripts, or ones that we've seen do well over the years, and help kind of build your messaging to be, reflective of what you would like, and be successful at the same time. So we've seen pretty much all of it, and we can help you, move forward.
Great. Okay. Any final questions from any of our attendees? You can put them either in the chat or in the Q&A section. Give people a moment to do so. Tabitha?
Okay, sure.
Okay. Well, it looks like we've answered all the questions for today, Tabitha.
Okay. Okay, well, as you guys see on the screen, we do have our product team contact information here, and we'd love to hear from customers. If you guys are thinking about strategic goals that you have for your health system moving forward, and you would love to see, this sort of feature provided, or, you have a need for XYZ or certain integration, something like that, feel free to email us and reach out. We would love to brainstorm with you on ideas and how our system and our platform can kind of help resolve and create a product that's valuable to you. So please do so. Like I said in the beginning, we will send out the recording of this webinar, as well as, make sure to follow up on any questions and answers, so that those can be reviewed and enjoyed by all. And then lastly, the Chime survey. So we would love to share some of that information with you. If you're interested, just let us know. Thanks.